Hello and welcome to our session on depression awareness. I'm Dr. Andres Fonseca. I'm a consultant psychiatrist and honorary lecturer at UCL and University of Roehampton. This is the way I would like to structure the discussion today. I'll discuss a few facts about depression and go through all the risk factors. I will talk about how it presents and why it might be hard to spot at times. Finally, I'll talk briefly about the different treatments and why we specifically endorse cognitive behavioral therapy. Depression is a mental health condition that affects around 300 million people around the world. The way it presents can be very subtle, and diagnosing it can be challenging. It is so common that access to appropriate treatment can be a problem. These issues contribute to make it the leading cause of disability worldwide, according to WHO. About 1 in 5 people are affected by it in the developed world. Depression is a complex condition, and we still don't fully understand its causes. What we know for certain is that there are several biological, social, and psychological factors involved. Issues like low income, trauma, and unemployment can make people especially vulnerable. Other factors that contribute to the risk are having a family history of depression, being female, or being under 30. If you have depression, you might find it's hard to explain it to those who have never experienced it. The word depression has become so widely used that it seems to be losing its original meaning. This is a health condition that requires the attention of a clinician. Usually, when we talk about depression, the first image that comes into our mind is that of a person feeling very, very sad. This is an oversimplification. While one of the primary symptoms of depression is low mood, this doesn't really describe what's going on. Depression is normally characterized by a depressive mood, which can be sad, but can also be irritable or simply a feeling of emptiness. People also lose the ability to enjoy the things that they normally like doing. People with depression also experience a range of other symptoms which are psychological, such as a feeling of guilt or a loss of confidence, cognitive, like an inability to concentrate, biological, such as poor sleep, changes in appetite, or feeling tired all the time. Depression normally affects the person's ability to function as they normally would in their everyday life. Depression might be particularly hard to spot if the person is able to function reasonably well. People with this variety have depression just the same, only they've learned to carry on with their lives despite not having any joy or fulfillment. Basically, they're playing a role 24/7, the role of a normal person. They may act joyful, they may smile, they may seem enthusiastic and even happy when appropriate. They are doing these things as an act of pure will, as they feel that they have to carry on, usually for the sake of others. Their life can be in order, their career on track, and they may not show any obvious sign that something is not right behind the scenes. For an outside observer, a person like this can seem perfectly normal even after they've opened up about their internal struggle. Although high-functioning depression is uncommon, it describes the essence of what it means to live with depression. Most of the time, depression isn't overwhelming or profoundly bad. It is, however, a sustained state of joylessness with the added certainty that tomorrow is going to be just as bad as today. It is important to understand that depression is not just a negative mood, but a specific set of cognitive and biological processes that have to be addressed. Fortunately, despite its complexity, we have well-established methods to overcome depression. Antidepressants are probably the best known of these. However, in most cases these are not necessary and, like all medicines, They can be harmful when not used under the care of a physician. Another option is cognitive behavioral therapy, also known as CBT. This form of therapy has shown great success in treating depression. Depression usually presents with a very specific thought and behavioral pattern, and this pattern is what sustains it for long periods of time. Once this pattern sets in, it is very hard to get out of it unless you're aware of what is going on. There are other forms of therapy that also have proven to be effective. However, the one with the most evidence is CBT. Using CBT, we can overcome this pattern of thinking and acting that is typical of depression by identifying and consciously changing it. In mild cases, the depressive pattern can be identified through a few simple techniques, such as using a CBT journal or practicing mindfulness. These techniques are available within the Thrive app, particularly in the CBT program. More severe cases likely will need some form of therapeutic guidance and even medication. For more detailed information on depression, you can visit the Mental Health Foundation's website and search for depression, or the NHS website on www.nhs.uk and search for depression as well. Also, please check the companion notes to this audio blog on our website. Thank you very much.